Hi, my name is Hans Lee from MD Anderson Cancer Center in Houston, Texas. And there was a lot of exciting data presented in multiple myeloma at the ASCO and EHA annual meetings that just concluded earlier in June. In this video, I'm going to be highlighting several exciting abstracts that were presented, including the phase 3 MAIA overall survival results in newly diagnosed transplant-ineligible multiple myeloma patients. I'll also be highlighting some of the updated data and some of the novel therapies being explored in multiple myeloma, including 2 BCMA CAR-T therapies, idacaptogene and ciltacabtagene. And finally, I'll be highlighting updated data from the phase 3 ANDROMEDA study, which was a study looking at daratumumab, Cytoxan, bortezomib, dexamethasone in newly diagnosed AL amyloidosis patients. The first abstract I'd like to highlight was a late-breaking abstract presented at EHA, which was the overall survival results of the MAIA study. So the MAIA study was a phase 3 randomized study in newly diagnosed transplant-ineligible patients comparing daratumumab, lenalidomide, and dexamethasone versus lenalidomide and dexamethasone. And we know from the previous results that have been presented that the overall response rates, the depth of response, and the progression-free survival all favor the daratumumab-containing arm in this particular study. And what was highlighted in this late-breaking abstract is that with longer overall survival follow-up, or longer follow-up, a median overall survival was actually significantly higher in the daratumumab-containing arm, with 2/3 of patients alive at 5 years in the daratumumab-containing arm versus just over 50% of patients alive at 5 years in patients treated with lenalidomide and dexamethasone alone. And so this abstract, I think, really highlights and sort of confirms the use of daratumumab and lenalidomide and dexamethasone as a standard of care and perhaps the preferred standard of care for newly diagnosed transplant-ineligible multiple myeloma patients. Moving on to the relapsed refractory multiple myeloma space, there was updated data presented on ciltacabtagene autoleucel, which is a BCMA CAR-T therapy presented at both ASCO and EHA. And we know from previous data that this therapy has elicited unprecedented response rates and depths of response in really heavily pretreated multiple myeloma patients with a median of 6 lines of prior therapy and nearly 90% of patients being triple-class refractory, meaning refractory to IMiDs, proteasome inhibitors, and anti-CD38 monoclonal antibody-based therapy. And this data presented at ASCO and EHA really highlights the longer-term follow-up data, which demonstrates that these responses also seem to be very durable, with a median progression-free survival, or not reached yet, and an 18-month progression-free survival of 66%, really demonstrating this encouraging data with this novel therapy in a very, very challenging patient population to treat. Likewise, there is updated data presented with idacaptogene and viclucil, another BCMA CAR-T therapy that was actually the first BCMA CAR-T therapy to garner FDA approval in March of 2021 and currently under review by the EMA. And we know that this CAR-T therapy elicited very deep responses and very impressive progression-free survivals in a very heavily pretreated patient population like ciltacabtagene autoleucel. And with longer follow-up, we now see an overall survival results reported of just under 25 months for patients treated in the phase 2 pivotal KarMMA study. Finally, I'd like to highlight data in an AL amyloidosis study. So the updated results with longer follow-up were reported in the phase 3 ANDROMEDA study, which was a study comparing daratumumab, cyclophosphamide, bortezomib, and dexamethasone versus cyclophosphamide, bortezomib, dexamethasone alone in newly diagnosed AL amyloidosis patients. And we know from previous reports that the study did meet its primary endpoint with a tripling of complete hematologic response rates in the patients receiving the daratumumab-containing arm versus those who did not. And this actually ultimately led to the FDA approval of subcutaneous daratumumab for newly diagnosed AL amyloidosis patients earlier in 2021 and is currently under review by the EMA. I think what was really exciting about the longer-term follow-up data is that we see not only very, very high complete hematologic response rates in patients who received daratumumab CyBorD, but at 12-month follow-up, we actually now see continued organ responses and a doubling actually of organ responses in both the heart and the kidneys at 12 months in the patient who received daratumumab, Cytoxan, bortezomib, dexamethasone versus the non-daratumumab containing therapy. So this really establishes, I think, subcutaneous daratumumab plus CyBorD as a standard of care in newly diagnosed AL amyloidosis. I'd like to thank everyone for watching this video on some of the highlights presented in multiple myeloma data at the EHA and ASCO annual meetings. Thank you very much.